Association for Rare Disorders, NORD, who is going to enlighten us on the many things NORD provides to our community. First, however, if you are new to the MGA and need patient packet, please email us at info@mgakc.org and we will get one sent to you. Additionally, following the session today, you will receive a survey and we'd love your feedback. We have another virtual opportunity coming up on Saturday, January 31st at 10 a.m. Central Standard Time to learn more about the newly approved therapy to treatment MG, a maybe. You will be able to register in the following up email being sent. For tonight's session, please put your questions in the Q&A and we will monitor them for the end. Alicia, let's take it away.
Thank you so much, Haley. Hello, everyone. Good evening. And again, my name is Alicia Lawrence, and I am the Information and Resource Services Manager here at NORD. And tonight I'll be sharing how NORD's Information and Resource Services team works to support individuals living with myasthenia gravis. We'll explore the resources we provide and the ways that we respond to inquiries. Our mission here at NORD is improving the health and well-being of people with rare diseases by driving advances in care, research, and policy. The IS team, which is the Information and Resource Services team, consists of myself and Marianne Maltus, who's our information specialist, and together we provide support and resources to individuals who reach out to our team. NORD's Information and Resource Services is one way that NORD responds to the unique needs of the rare disease community. And it is through this team that NORD is often the first organization that patients and caregivers connect with looking for support. And because of NORD recognizing the critical need, the IS team was created as a trusted information and resources to tailor to the rare disease community. Patients and caregivers and others reach out to us for help with a variety of needs, and our team responds promptly, offering guidance and connecting them with the right resources to ensure that you feel supported in every step of the way of your journey. Some of our common inquiries include newly diagnosed patients looking for information on their diagnosis as well as support. And we can provide the information and organizations that support the diagnosis. We also get calls regarding financial assistance, both medical and non-medical, and we're able to provide other resources that might be able to assist with the request. Some are calling for supportive resources. They could be wanting to be in touch with others with their diagnosis and looking for an organization that supports the diagnosis, or possibly just looking for emotional support such as counseling. We're able to walk alongside you, not only on your rare disease journey, but also to support you through any life challenges that may come along the way. We provide, and we take pride in this, providing a patient-centered approach that goes beyond your medical needs to include emotional, financial, social, practical concerns, helping you to navigate the complexities of living with a rare diagnosis. Our team supports patients throughout their entire journey by offering compassionate guidance, practical resources, and personalized assistance. We take great pride, like I said, in using a patient-centered approach for every inquiry, ensuring that the information and resources that we provide are tailored to each individual's unique needs. You're not alone in this journey. And through NORD's Myasthenia Gravis Assistance Program, we provide financial help for out-of-pocket costs related to your care. Because honestly, your energy should not be, towards worrying about expenses, but more so about healing. Managing your myasthenia gravis can bring unexpected costs, and we're here to help. Our assisted programs covers a range of expenses like lab services, office visits, consultations, physical and occupational therapy, supplements, and even travel and lodging at times. Under our premium assistance program, we're also able to help with prescription coverage, both FDA approved and some not, insurance deductibles, and COBRA premiums. If you need more details, just call us and we're here to help you along the way. For some living with myasthenia gravis, working may not always be possible. It can affect your ability to maintain employment. You may be eligible for Social Security benefits that can support you and your family. These programs can provide monthly income to help with everyday expenses when a medical condition makes it difficult or impossible to work. So I just wanted to go over a few terms. So supplemental security income. This is a program that provides monthly payments to people with disabilities or older adults who have little or no income and limited resources. Additional eligibility requirements include age, which is 65 or older, or having either a disability or a blindness. Social Security disability benefits is monthly payments for those people who have worked at least for a year. The money can help cover basic needs like rent, mortgage, food, utilities, and clothing. Many rare disease Many rare diseases are included in a list through Social Security Administration called Compassionate Allowance. And this list helps to move certain conditions to the front of the line so that your application could possibly be reviewed faster. And you can see there's the list of conditions on the website if you go to ssa.gov. Even if your condition is on the list, though, it's important to know that it still takes time and you want to just make sure that you read what's necessary documents are needed before you apply. This can make the process a lot smoother. And for more details on how to apply, you can visit the website, ssa.gov, or you can call Social Security by phone at 800-772-1213. As I mentioned earlier, Social Security disability provides monthly payments to people with disabilities that prevents them from working. And to qualify, you need to be not be able to work or have worked have enough work history. And that's usually like between 5 to 10 years. And in some cases, you may be able to get benefits through a spouse, your ex-spouse, a parent who's currently getting Social Security disability. Understanding insurance. This is always a big topic. And I just wanted to go over just some quick reminders as it relates to Medicare and Medicaid. Medicare is a federal program for those who are 65 years and older, some individuals that are younger with a disability. And it's important to know that it's a nationwide program, so it's the same program throughout the country. Medicaid, on the other hand, is a federal and state program that covers medical costs for some people with limited income and resources. The important thing to remember here is that Medicaid does um, vary from state to state. So it's important to just make sure that you're able to know what, your state offers. If you move, then you should again think about what is offered under Medicaid in another state. In some situations, some people are what is called dual eligible, where they can be getting Medicare and Medicaid. And when this happens, the two programs work together to reduce the costs and increase coverage. Medicaid may help with Medicare premiums. It can also help with things not covered by Medicare, like long-term care or transportation. Also, two other insurances is the health insurance marketplace. For those who may not qualify for traditional Medicaid, there is the marketplace, and it's run by the federal government, and it helps people and families and small businesses. And what it does is it compares health insurance plans for coverage and affordability. Commercial health insurance is also called private health insurance, which is usually issued by a company or entity. And it's important to remember that this is not government issued insurance like Medicare or Medicaid. Health insurance navigation, there's a lot that goes into it. And, you might be finding that your prescriptions are not covered, that your treatment is being rejected. What can you do to make sure that the prior auth is done? And how do you go about appealing a decision? And sometimes, like we said, insurance companies deny a claim, which means they refuse to pay for a service that was provided. And you could be going to and what are some of the things that may happen or reasons why they do deny it is because of provider is out of network. You might have needed pre-authorization and the insurance company denying it because they didn't know that you were doing the test. A medication may not be in formulary, or sometimes the claim is missing or has incorrect information, such as the wrong code. We know that insurance denials can be very frustrating and overwhelming, but understanding what can happen makes it a little easier to navigate the next steps. So, in talking about pre-authorizations, when your insurance company reviews a test, treatment, procedure, or medication before you receive it, the goal is to make sure that your doctor recommends the service and that the service is medically necessary and covered under your plan. The doctor's office usually will have to contact your insurance company to submit paperwork as to why you need the service. And then the insurance company reviews it, your diagnosis, the medical notes, treatment guidelines, and what will your insurance plan covers. If approved, then great, you can move on with, what it is that you're trying to get done. Sometimes the insurance company is still on the fence and needs more information, so they'll contact your doctor and your doctor will have to send additional information, but then it can be denied, and meaning that the insurance company doesn't agree to cover it, and your doctor can help you appeal or explore other alternatives. You and your doctor are notified of whatever the decision is, whether it's approved, denied, or needing more information. And it's important to really consider pre-authorization and why it matters because it helps to avoid unexpected cost. It also ensures that the service meets the insurance company's medical necessity criteria. And it can prevent also delays in scheduling a procedure or possibly filling a prescription. If it is that you do need to appeal, everyone has the right to appeal a decision made by insurance company. There are different limits and when you can make the appeal depending on your state. And so you should always apply for appeal as soon as you're able to. And make sure that all of the information about your case that the insurance company will need is in order to approve your appeal. Make sure that you have everything in place. If you're unsure about what documentation your insurance company needs, you may need to either look up on their website or call them for more information on what is the next steps as it relates to the appeal. And it's important to know that anybody can begin to appeal a decision. It could be you, it could be the doctor, the nurse, or even a pharmacist can do that. I know that was a lot of information, and we also have what we call Claim Your Care at NORD. NORD's Claim Your Care is a helpful resource with clear, easy to understand information about health coverage. We offer resources to help both patients and caregivers learn basic insurance and how to address common challenges. Some of the helpful information you'll find is a health coverage toolkit, which explains how insurance works. It offers tips on using your coverage. It also includes a glossary of common healthcare terms and acronyms. And you can find this information at claimyourcare.org. Or you could also go on the NORD website as well. Although self-advocacy is important, and I strongly encourage it and tell patients when they call to advocate for themselves, sometimes you may need some guidance, and that is where knowing what other resources may be available is helpful. So, patient advocacy organization like the National Organization for Rare Disorders, you can always give us a call and we could provide support and guidance, but also too disease-specific advocacy organizations like the Myasthenia Gravis Association is also a helpful resource in any challenges you may be facing as it relates to your diagnosis. And as far as disability resources, here are some disability resources that may be helpful when you have questions about your rights, employment, or available benefits. So you have the American with Disabilities. They actually have a homepage, ada.gov. The Job Accommodation Network, which is a good resource in answering questions as it relates to, maybe wanting to talk to your supervisor about what's going on. They can provide guidelines, accommodations as far as, what's the policies nationwide as it relates to accommodations. And as Social Security Administration, of course, if you have questions as it relates to some of the benefits we talked about, Social Security disability, supplemental security income, as well as Medicare, Social Security is a good resource for that. At NORD, we have our communication center within the Patient Services Department, and we're here to help in any way that we can. Our communication center runs from 8:30 a.m. to 7 p.m. Eastern Standard Time, Monday through Thursday, and Friday, 8:30 a.m. to 6 p.m. Eastern Standard Time. In the patient services team, we do have the information and resource services team, which has the same hours but different telephone number. And our email address is informationservices@rarediseases.org. I know that this was a lot of information, but I hope you found it helpful. And our role in the information and resource services team is to be here to support you. And so again, we're available. If the times don't work, you can always send us an email. We do our very best to make sure we get back to inquiries as soon as possible. Um, but we do answer every call and every email. And I can also be reached personally at alawrence@rarediseases.org. And I thank you for your time this evening. And if there's any questions, I'm more than happy to answer any questions you may have.
Awesome. Thank you so much, Alicia. It looks like we've got one question here in the chat for you if you're ready for it.
Yes.
What would qualify a person to get both Medicare and Medicaid?
So Medicaid, remember, is a income-based, it's a needs program. So you have to be sure that you're able to meet the criteria, the threshold. Every state is usually about the same, but you would have to apply for Medicaid and find out if you're eligible. Um, Once you know that you're eligible, you could, Medicare will automatically be aware that you have Medicaid, and then the two systems will link together and to provide the services that you need. But it's best to look at your state requirements for what the Medicaid guidelines are.
Wonderful. Thank you. If anybody has any other questions, we're happy to answer them. So feel free to put them in now. We've got another question here saying, do you have information on clinical trials?
Yes. So we do get calls often related to clinical trials. If you'd like, you can either email me directly and I can get that information to you, or you can call us at 800-469-0283. I'm sure the team will share that information with you guys at the end of the presentation, or our email address, like I said, informationservices@rarediseases.org.
Another question here. It says, I think when I filled out your application this year, it asked if I had dental insurance. I do, but wondered if I can also send that in for reimbursement.
So you I believe you can. I think it is it's premium copay, but if it's your supplemental, you can send in the reimbursement. The expense team will be in touch if it is that they are not able to, but we do have two programs and you are able to apply for both. So if you apply for copay assistance and you realize, well, like you said, you have a supplemental insurance, please reach out to the program and apply for the premium assist, and they may be able to help with the reimbursement for that.
Another question here. I recently participated in a survey with NORD about living rare. Are you aware of that and have they published the results yet?
So it's a longitudinal study over time. So we do I know that they are collecting the surveys. They are really looking at it. Sometimes patients that fill out the survey have other needs. And so the information services team gets those um, responses. So I know that they are looking at them, and I believe it's over time. The study is over time. Thank you for doing the survey.
Another question here we have, what do you do when you have blood tests that were AChR positive, but all others were negative, and the retake test was borderline AChR positive? I now have two specialists with different views. One says I have MG and others do not. Any advice?
So we don't give we're not a medical provider or a healthcare facility, so we're not able to give that kind of advice. However, we do have centers of excellence throughout the country. Again, we have other resources that we can tap into. So if you'd like, you can, send us the inquiry and we can explore what other types of um, specialists or researchers, that may be able to help with that.
Thank you for sharing that, Alicia. Can the insurance assistance that you provide cover past insurance? I put about $1,200 in insurance charges on my credit card after I didn't qualify for marketplace subsidized last year.
Because it's last year, no, it would have to be in the current year. So if it is that, you know, this happened maybe in June and you're applying in November, quite possibly they may have been able to reimburse you for maybe not all of the whole year, but maybe some portion of it. But I would say if you think that's going to happen in 2026, the program may be able to help alleviate some of those expenses for you.
I was just hospitalized and will be billed $3,000 as my cost. I have good insurance and a good income. Would your services still cover costs like my $3,000 bill?
As long as it's related to myasthenia gravis, quite possibly. There are caps on the awards. I'm not sure what the cap is for myasthenia gravis, but that would be something that would maybe fall under the medical assistance program. And so, um, it may be contacting the team directly to find out if that's something that would be covered. But if not, we also have resources that may be able to help with that as well.
Just a couple great points in here. Everybody has been thanking you for this awesome presentation
Oh,
here,
thank
and
you.
that saying it's NORD's been a huge help to me, and thank you for being there. So everybody's
Thank
appreciative.
you. Thank you. That's what we are here for.
Any other questions here? Happy to answer them while we've got time. Here. Okay, if we have no other questions, I think we will end our webinar here. Thank you so much, Alicia, for taking the time out of your evening to come and speak with us. And thanks to all of you
Absolutely.
for joining us tonight for our first virtual monthly meetup of 2026. We hope to see you at more in the future. We hope you all have a great rest of your evening. Thank you.
Bye, everyone. Thanks again.